Puerto Rico Medical Board style clinical vignette. Topic: GFR, plasma blood flow, clearance, reabsorption, and secretion. Clinical vignette. A 45-year-old male with a history of hypertension and type 2 diabetes mellitus presents for a routine checkup. Laboratory results show that his serum creatinine is mildly elevated. A urine sample is collected, and a 24-hour urine test reveals a glomerular filtration rate, GFR, of 60 milliliters per min. The patient is concerned about his kidney function, and the physician explains the physiological mechanisms that determine kidney function, including GFR, plasma blood flow, clearance, reabsorption, and secretion. Which of the following statements accurately describes the relationship between GFR, plasma blood flow, and the kidney's ability to filter and excrete substances? A. Increased plasma blood flow leads to a decreased GFR, and clearance remains unchanged. B. Reabsorption of substances occurs primarily in the proximal convoluted tubule and is dependent on active transport mechanisms. C. Secretion is the process by which substances from the urine are transported back into the blood. D. An increase in GFR directly corresponds to an increase in the reabsorption of sodium. Correct answer: B. Reabsorption of substances occurs primarily in the proximal convoluted tubule and is dependent on active transport mechanisms. Explanation: incorrect. Increased plasma blood flow generally leads to an increase in GFR, glomerular filtration rate, because the kidneys receive more blood for filtration. However, the relationship between blood flow and GFR is more complex and depends on the balance of afferent and efferent arterial tone. The clearance of substances can change depending on how well they are filtered and whether they are reabsorbed or secreted. B. Correct. Reabsorption occurs primarily in the proximal convoluted tubule and involves the active transport of substances like glucose, amino acids, and sodium. These substances are reabsorbed back into the bloodstream to maintain homeostasis. This process is crucial for conserving essential nutrients and electrolytes. C. Incorrect. Secretion is the process by which substances, like potassium or hydrogen ions, are actively transported from the blood into the urine for excretion. Secretion does not involve substances moving from the urine back into the blood. D. Incorrect. An increase in GFR does not directly correlate with an increase in sodium reabsorption. Sodium reabsorption is primarily regulated by aldosterone and angiotensin II, and while GFR can influence the amount of filtrate passing through the nephron, sodium reabsorption is not solely dependent on GFR. Key takeaways. GFR, glomerular filtration rate, is a key indicator of kidney function, which can be influenced by plasma blood flow and the ability of the kidneys to filter blood. Reabsorption primarily occurs in the proximal convoluted tubule, where active transport mechanisms are used to reclaim nutrients and electrolytes from the filtrate. Secretion is the process by which the kidneys actively transport substances from the blood into the urine for excretion, helping regulate acid-base balance and remove waste products. Plasma blood flow and kidney filtration are tightly regulated to ensure efficient elimination of waste and maintenance of homeostasis. Let me know if you'd like further